Hello everybody, this is Dr. Alexandra Chaus, Doctor of Physical Therapy, and today I'm going to talk about cording or axillary web syndrome, and later I'm going to give you a very effective stretch that's very gentle and it's going to help you to make the cording more flexible and sometimes just could be gone or to prevent it. Okay, so let's go and talk more about what is this about. So the axillary web syndrome or cording occur 86% or a little bit more in patients after breast cancer surgery, but especially these two types of surgery. When they do the lymph node resection, they remove the lymph nodes, or when they do the sentinel lymph node biopsy. These two conditions tend to be, predisposed to cording. Still, there is not medical literature that said why that happened. So, but could happen, remember, up to 86% after breast surgery. And how can you tell that you have cording? So there is some signs and symptoms that I want you to pay attention. So the first thing is like a painful discomfort in your entire arm, and you're going to feel it the most when you bring the arm up. You're going to feel like something is pulling. The cording, how do you know it's a cording? The cording, you're going to feel it in the entire arm or just in sections. And in the arm that you got the surgery, also you're going to feel it on the chest wall. So, and the good thing, physical therapy can help you with that. When do you notice the most that the cording is there? I would say what I read and after my research is between the 2nd and the 8th week after surgery is when you can start developing symptoms. The thing is, this can occur even years after surgery or reappear after what's gone. So it's very important always to do exercises, to do stretches. Don't stop there, just keep moving, and that is going to help you to prevent it. Okay, so now let's go with the stretch. So the thing that you're going to do is you're going to always think in the position of your shoulders. So the first thing that you're going to do, let's say, is here where we have the cording. You're going to bring the shoulder down. You put both shoulders down because in that way you're going to be more balanced in your posture. So bring those shoulders down, and then you're going to start bringing your arm up. I'm going to go a little bit back so you can see me. So you're going to start bringing the arm up until you start feeling a tension. When you start feeling a tension, you will feel it all the way down or just in a specific area. You are going to bring the hand or the wrist up and down. I want you to do it to the point that you stretch the cording. Remember, every time that you do it, you're making that cording more flexible, and sometimes you can hear a pop and a big relief. So that's a good news. When you hear a pop or a sound, it's because the cording is becoming thinner or it's just dissolved. So you're going to do this. I would say you do it until you feel that you need to take a break. Okay? Just bringing the hand up and down. Then take a break, shake it, and then after that you're going, I forgot to tell you, you can do this while you are lying down in bed, or because when you are in bed you don't have the gravity pushing the arm down, so you will get less fatigue, or you can do it standing. I would say if you want to do it in front, like resting your back on the wall. So you are also, that will help you with your postural awareness. So that would be even better for you. So let's bring those shoulders back. This is the second exercise. So you bring the arm up. And this, what are you going to do this time? You are going to rotate your hand, pay attention. Rotate from the shoulder. Rotate, rotate, rotate. If you feel that it's pulling there, pay attention. You can feel the pulling already here or here, but look for that pulling. You go there, look, my hand is still with the fingers down. This time you're going to move your neck to the opposite side of the shoulder. So to the opposite shoulder. And you're going to do it very gentle. Remember, you have to be gentle with yourself. You are not running for a sprint. You're running for a marathon. Everything has to be gentle so you connect with your body and you know what is going on and you don't overdo it and then end up being very sore. When you feel already that it's enough, you just take a break and shake it again. Then another one, there are many ways to stretch the cording. So I'm going to give you a few more. So in that way, I would say, grab one that you feel more connected with, the one that you said, I feel it the most with this one, and that's the one that you are always going to do, and you're going to do it twice a day, okay? So the other one, this is number 3. So what you're going to do, you're going to use a wall. So you're going to always start bringing the shoulder down, then you put your hand on the wall. Sometimes your hand is not going to be all flat, it's okay. You put it as comfortable as it feels, but with the pulling. And then what you're going to do, you're going to bring the shoulder forward. Over here. Forward. It's the shoulder that is going forward. So you're opening here because the cording starts from here. So you bring it forward, forward. Remember, you're going to say about how many times? The times that your body feels comfortable. No producing pain, just the stretch. Sometimes could be 5, sometimes could be 10. And then what you're going to do, then you move the neck to the opposite side, like trying to touch the opposite shoulder. And count at the 5, but like I said, everybody is progressing in different times. So that is why I cannot tell you to do 10 or 15 or 30 because everybody is progressing in different time and I totally understand it. Okay, and now the other one that you're going to do, but you see everything has to be with the elbow straight because it's the way to stretch according. So the other one that you're going to do is call it like a nerve glide because we are stretching. This is a technique that we use to stretch the nerve. So what you're going to do, check it out, it's pretty cool. So when the hand go up, the neck, the head goes toward the hand, and then the head goes far, the hand goes down. They call it nerve glide. Always keep the elbow straight. Feels so good. So I feel like it's a stretching, and this is my dominant hand, so feels great, So this is also a very good one if you spend a lot of time in the computer or writing, that would really help you to release the tension in your hand. Or you use your hands a lot for the pain of your activities, right? That would help. And then take a break and shake it. So that one more, one more. So you're going to do, but you see everything has to be stretching. Okay. Oh. So again, you bring the shoulders down. You start bringing the hand up to the point of pulling. As soon as pull, right? You rotate your hand. And this time you go against the wall again. And you just can go like making a, what is it? Like a half, like a C. Just like that. And like that. Okay? So these are all stretching the core. So pick the one that you connected the most. Very important. Always keep the elbow straight. Go gradual. Start low. I have to stand up on my toes. If you feel it right there, keep it there. Next day, try to see if you can go higher. Could be next day, could be next week. Next time, try to go higher. And the one that you want to reach, that your goal would be at 90 degrees. You see the angle here? This is 90 degrees. That is when you reach your goal. Don't go from day one straight to 90 degrees. You have to take your time. Everybody progress to their own speed of healing. So just listen to your body, connect, and do it gentle. Do every day 2 times a day, okay? And I hope you enjoyed this video. If you have more questions about cording, please write it down. I'm very happy here to help you with your doubts and concerns and help you to learn more about how to gentle stretch the cording, how to gentle prevent the cording, because it's, remember, up to 86% of patients develop cording, so it's very high. Okay, my sweet people, have a beautiful day. I'm here to help you with this. I send you a lot of love. My dog is having a nightmare. Have a beautiful day. See you soon with another video.